I don't have a GI character. It's too easy.
Dr. Will Flanary, also known as Dr. Glaucomflecken, is a practicing ophthalmologist in real life and one of the funniest physicians on the internet, where he has over 1 million YouTube followers. In our conversation, he shares stories from the beginning of his career.
And someone offered me a stool to sit on for the first day. I was like, this is it. I'm an ophthalmologist. I'm like, what's all this standing?
Including his personal experience surviving a cardiac arrest.
My wife woke up to the sound of me gasping for breath. She ended up doing 10 minutes of compressions.
Welcome to Stanford Department of Medicine's Inside Look at the Future of Medicine. Thanks for coming to Stanford Department of Medicine Grand Rounds.
What an amazing place. Last time I was here, I was interviewing at the ophthalmology residency program. Yeah,
okay.
So.
Yeah, but things went in a different direction for you.
Yeah, you know, things will always work out like
they seem to be working out quite well. As I mentioned just a moment ago when you were talking on stage for Department of Medicine Grand Rounds, I think you may be one of, if not the most famous medical doctor alive.
There's a few others.
Yeah. None of them are as funny as you, though.
Maybe in the world of ophthalmology, I would say.
Yeah. You're certainly the most famous internet sensation, TikTok video, ophthalmology comedian.
Put more qualifiers in there.
We've ever had at Grand Rounds, yes. Yeah.
Well, good.
But what an incredible story, and we, record turnout, of course, to see you. Just so many people coming back in person, which is what we're hoping for our new Grand Rounds. When we came to think about who we could get, who might help us, really only one name rose to the top.
Oh, is that right?
It was your alter ego's name.
Yeah.
Because I'm not sure many people know your real name.
People did a great job of saying Glaucomflecken today. I think everyone said it correctly.
I sent everyone a picture of some Glaucomflecken just to remind them and me. what
most people don't know what that is. No. It's a real thing in ophthalmology.
So let's go back to your. Tell me, were you funny growing up?
Yeah, I was. I always, I loved making my friend group laugh.
Yeah.
I was always, and I was a class clown. It got me into trouble from time to time.
Yeah, what sort of trouble?
Well, I was also a smart kid, so I was in gifted education classes, and my mom actually in 6th grade, she taught the advanced language arts class.
Oh, okay.
So I was in her class. Wow. Terrible idea. No, it did not go well. So she was a little harder on me than other kids.
Okay.
At one point, because I kept acting up, and she sent me to the principal's office.
Okay.
And
your mom said you.
Yeah.
Okay.
And I got a discipline report I had to get signed by my dad. So yeah.
Was she funny? Were your mom and dad funny?
Oh they have a good sense of humor for sure. But no, I mean my dad's an engineer, aerospace engineer.
Okay.
My mom's a teacher, and so none of them are in the entertainment comedy world.
Right.
I got started in it just with a friend of mine. We decided, he was actually doing stand-up comedy in Houston, and I just was like, I'll tag along, I'll check it out.
And you were in high school then?
I was in high school, senior in high school, yeah.
Okay. And before that, you'd just been making your friends laugh?
Yeah, just cutting up in class.
Yeah. So what did it take to move from, just making fun of people in a little group to getting on the stage with a microphone?
It was exhilarating. Yeah. I remember my first time on stage, I had 5 minutes of jokes. I spent so much time writing these jokes. Yeah. My first joke, I don't remember what it was, but I remember it went off great. Okay. Big laugh. Okay. And then I bombed the rest of the set. It was like that. I needed that first. I was like, whoa, this feels so good. Just the rush of making a room full of strangers laugh. There's nothing quite like it. And this is a big dopamine rush.
Yeah, it seems, that's what I was going to say. It must be something that you're forever chasing as a...
Inherently, stand-up comedy is a bit selfish. You all have to listen to me talk for the next X amount of time. It's fun to create something that results in that response. Because, a laugh is such a basic, primal response to something, and so being able to get that out of somebody is really fun.
Yeah, and we
even
know
to this day
about all the positive health benefits.
Absolutely,
from people laughing, which is amazing. But then, had you thought, were you thinking of a career at that point?
I never really seriously considered a career in comedy.
Right.
I loved science. I was thinking about med school early on, in high school. I was thinking maybe I want to be a doctor. Yeah. The comedy always just felt like kind of just something I'd like to do. Yeah. Whenever it's a hobby, there's less pressure, right? And it kept it fun for me. Yeah. And so the whole time I was always like, this is just something I'll do on the side. Yeah. And turns out I just was able to turn it into basically a career.
Yeah.
2 full-time jobs now.
That was, you were telling me earlier, you are an ophthalmologist 4 days of the week.
Yeah, still practice for that. Surprises people. Because they see all the content and think like, how on earth is he able to also see patients?
And you have 2 kids.
And 2 kids and a wife. And so life is busy, but I have a lot of help. So the Glaucomflecken, it's not just me, and it can't be. There's no way I could do all of this by myself. So a lot of credit to my wife, obviously, who runs the Glaucomflecken empire. Right. Yeah.
Well, you were describing the show that you've done with her. This
we did a show called Wife and Death, which we toured it around to theaters and comedy clubs last year and a little bit this year as well. Just telling our story. Yeah,
and you were doing that on the weekends?
The weekends.
The family would go.
Any free time, exactly. They bring the kids. They'd run the merchandise booth. They'd put up signs and stuff. And,
That's great.
Yeah, they loved it.
Hooking the merchandise for you.
That's right.
That's good. Probably pretty good sales people.
Oh yeah, it's hard to turn down a little cute 10-year-old with curly blonde hair.
Yeah, I get that. That's probably a very profitable staff.
He's like, "Do you want this picture of my dad?" He says, "Or you can get this one and this one. Yeah. Look, don't you like this one?" Yeah, so she's good at it.
Very effective. Very effective.
Just don't tell her that she doesn't get commission.
She doesn't know.
Hourly rate.
I see. No pocket money commission there. Yeah, you told a great story a few moments ago on the stage about how you ended up in ophthalmology, not in vascular surgery.
No.
Give us a little sense of that.
Oh man, I didn't know what I wanted to do when I got into med school. I just knew I wanted to be a doctor, and it took a long time for me to figure that out. I was banking on the clinical rotations, being the thing. Like, okay, I'll figure it out, doing all those rotations. Yeah. My first clinical rotation was vascular surgery, which is a heck of a way
it's a hard way to
jump into the hospital medicine. Hard rotation. I remember that first week, just trying to survive, trying to just do what I can to be helpful. Yeah. I remember I had my short white coat on, just full of bandages and tape. Yeah. It was like a pack mule. I was just holding all this stuff. And then at the end of the first week, the chief resident pulls me aside. He's like, "Will, we really need you to hit the automatic door buttons earlier on rounds." And it's like, I didn't know this was a core competency. No one told me. I had to time it perfectly. So they don't have to slow down. So they do move very quickly through the hospital.
They do.
And then eventually, I realized I loved surgery, but that rotation wasn't for me. That specialty wasn't for me. 5-hour, 6-hour, 7-hour surgeries, just standing in the operating room. I left that rotation and started a 2-week ophthalmology elective, and someone offered me a stool to sit on for the first day. I was like, this is it. Yeah. I'm an ophthalmologist.
This is for me.
That's all I need. I just sit down. Like, what's all this standing? No.
Yeah. A little less blood as well.
Yeah, a little bit. Very much. Very opposite in so many ways to vascular surgery.
Yeah, it's amazing how our specialties are really so specialized. I mean,
they are, and it's just getting more and more subspecialized over time. And I've lost track of how many internal medicine fellowships there are that you can do.
Yeah, I should know that.
As a cardiologist, can't you do like a vein fellowship? I don't know.
Pretty much, the left anterior
inferior
descending
vena cava.
Just one at a time. Yeah, exactly. But yet somehow, and you talked about this on stage, but in order to do comedy at the level you do, I mean, this is one of the reasons I think you've been so successful. I mean, you really are razor sharp with the things we like to make fun of ourselves, the things we understand about ourselves, and your sense of being able to observe that, then make fun of it in a very generous way, I should say, is just straight on. But that can't come, you can't remember all that from medical school, surely.
No.
How do you, tell us about your process.
Yeah, a lot of the characters I draw on interactions I've had with people, for sure. There's a neurologist that I remember from med school, very much like my neurologist.
Big glasses, big brain.
Yeah, exactly, big hair, all this stuff. And then, the typical surgery, anesthesia dynamics. So all the personalities and the how they interact with each other, that's all med school pretty much. I do have to, whenever I include like actual medical knowledge, because there has to be some of that, right? I have to do more and more research. I don't remember any of that stuff. I'm getting on like Reddit threads from like 8 years ago, or people, basically trying to figure out what are the pet peeves that different specialties have, and what kind of irritates this person versus that person. if you're making content for a bunch of physicians, a bunch of people in medicine, like the first thing they're going to do is point out any kind of medical errors.
Right.
Regardless, it could be the funniest thing in the world. If you said something wrong about furosemide, like you're going to hear about it, and that's all people. They're going to latch onto that, and that's it. So I do have to be careful to make sure I'm as accurate as possible.
Yeah, which makes you probably one of the most generalist ophthalmologists.
Hey, I probably do. I've got to be top 1% of ophthalmologists that know something about body medicine.
About body medicine, right. Well, and now you've been doing a few of these videos. I've seen one or two for the New England Journal of Medicine.
Yeah, it's been a lot of fun.
Yeah, thinking about how to expand the message even of a clinical trial. You must have had to learn a few words for those.
So for those, that was an interesting arrangement. I give a lot of credit to the New England Journal. Because they were thinking outside the box. They were like, okay, how can we increase engagement? How can we get people to pay attention to research? It's harder and harder. The journals are not, it's kind of an old-fashioned way of publishing, right? So how do you get that kind of engagement in the world of social media? And so they reached out and were like, hey, what if we give you some trials? You can just take a couple of them every month, make a skit about it. And I was like, I'll do it on one condition. I don't have to read all these trials.
That's right. Someone will summarize.
Because I'm an ophthalmologist. So I was like, give me a one-page summary, and the pertinent points. I'll make a skit about it, and then my other thing with that was I want to make sure that the trial that I make a skit about is published open access.
I heard that.
Anybody can have access to it. It's really important. And so it's worked out really well. I think the engagement's through the roof compared to what it has been, and people just love storytelling. They love comedy, and if you can combine that with research
on education,
no,
it's amazing.
Absolutely, the comedy abstract. That's basically
you're right. Comedy. More journals should do that. There might not be enough comedians.
There may not. I certainly can't do all of them, but really the message is just you can't keep doing the same thing. Media is changing so much. You have to adapt. You have to think of other ways to reach people.
And I think one of the things we all love about your comedy is it also has a moral center. And you've been vocal in relation to the publishing companies, for example. So the idea that any articles you're going to be commenting on are open source, I think that's really important. And
I was very intentional of who I would do something like this with. And the New England Journal is one of the better ones.
It's actually a not-for-profit, I think.
It's a non-for-profit.
Not sure many people know that.
Compared to some of the other bigger journals that, some of these publishing companies have profit margins of 20%. They make billions of dollars. And so I think that's a big problem. And so I was happy to be able to do this with the New England Journal.
Let me go back to your characters, because of course that's how we all really know you through. You talk about how you get the pet peeves and some of the material, but when you're developing a character, how do you get to decide what's the prop going to be, and how do you get, what's the magic sauce there?
That kind of, because I didn't want to have to, when I would make a video, I didn't want to have to put text to like reintroduce the character every time. Because everybody wears scrubs. So it's like I had to do something to differentiate who these people are. So I was like, okay, well, how is the internist going to be different from the nephrologist versus the cardiologist? The props are just my way of like showing so that people can see a character and know immediately that's the nephrologist. That's the emergency physician. And the props are the easiest way to do it. And it's just more of a natural way of introducing the characters, and they just stuck. The salt, it was just about hyponatremia. That was a common joke for me. I've made so many jokes about sodium over the years.
We love those.
That it made sense to just have the Morton salt container. Still waiting for Morton salt to reach out.
They have not.
No,
I'm very surprised.
we're trying. We're trying, but how much advertisement does salt need? I don't know. Probably not much. Every character, like I try to make it make sense. The props, like the emergency physician. So that's fun. That's one of the best parts. Is I've got a closet full of the most random things you can think of.
Well, and it's amazing because I wouldn't have guessed that a bicycle helmet would define an emergency physician for me, but it does. And every single one I speak to go, that's exactly right.
This is the adrenaline junkies. They're always on a bike or doing some kind of dangerous activity.
Many comedians talk about how much of their comedy comes from some amount of suffering they've had. That's a sort of a common thing for comedians to talk about. And you've obviously had your own medical challenges. You talked a little bit about them. Give me a sense of of those and
Sure.
how they've informed your approach to life?
Yeah, it's really common to use humor as a coping mechanism, and
Yeah.
I certainly have. You know, I was diagnosed with testicular cancer as a med student, and then again in the other testicle in residency. And then 4 years after that, I had a cardiac arrest that was unrelated to the cancer.
Yeah, that is not lucky.
No, definitely not. I was just, and I've broken the 4-year curse.
Yeah.
That's been 5 years now, so I'm free to talk about that.
Yeah.
You know, and with the first cancer diagnosis, I'd kind of gotten away from comedy a little bit, but going through that, it reignited my interest in it. I was like, what else am I going to do? I might as well just tell jokes about it. Just, it's a way to take whatever that horrible thing is that's out of your control and make it yours again.
Yeah.
And you know, turn it into something that you control.
Yeah.
And can share a laugh about it with others. It's a very powerful, cathartic, you know, thing, and that's why so many people use humor, especially medicine. There's like funny people everywhere in medicine.
Yeah.
Sometimes we have to just, you know, laugh about it.
Yeah.
You know?
Yeah. But it's also a gift, I think, that you're giving other people, other sufferers, people who've been through the same sorts of things.
A lot of the feedback I've heard over the years is related to the pandemic, and that people use my content to help them have a laugh at the end of a terrible day.
Yeah.
And that means a lot to me, because first of all, there's only so much an ophthalmologist can do during a respiratory pandemic.
Yeah.
So if I can at least help the people who have been helping people laugh and feel good, have some kind of hit of dopamine, you know, to just, you know, whenever they're seeing so much suffering, like that feels good.
Yeah.
And that's what actually kept me going and kept reinforcing my desire to make comedic content is because of that kind of feedback.
Yeah. And we've, as we talked earlier, I'm a cardiologist with an interest in inherited causes of sudden cardiac death. And so we see a lot of patients here at our Stanford Center who've been through exactly what you have. And it's, as you point out so well, it's not just the patient. In some ways, the patient's going through it. They have a lot to deal with, but it's the people around them. And in your case, it was even more dramatic than that, because it wasn't just that your family were nearby. They were actually part of the
my
event.
wife woke up to the sound of me gasping for breath at 4 o'clock in the morning. And she is not in medicine, so she didn't know what was going on. She just thought I was snoring, tried to get me to wake up, but I wasn't budging. So she called 911. Turns out I was having agonal breaths, which a lot of people don't realize, you know, are these, you know, purposeless kind of breaths. You know, you're not actually breathing, but it's a sign of cardiac arrest. And so she didn't realize that, and the dispatcher asked her 2 questions that they're trained to ask. Are you able to wake him up? Like, is he arousable? Like, you know, that's the first question. The other question is he breathing normally? And if the answer is no to both of those, the decision is to do chest compressions. And so she ended up doing 10 minutes of compressions. And
had she been trained in CPR before? So she was being talked through that by the dispatch.
The instructions, we've listened to the 911 call, you know, dozens of times at this point, because when we do live shows together, we'll play that call. It's very dramatic.
Really?
Very dramatic audio.
Yeah. And you were on the bed at the time.
I was on the bed. I'm like 100 pounds heavier than her, so she wasn't moving me, and just kept doing it until they showed up.
That is really good CPR.
It is. It's amazing. I still don't know how she did it, but you know, it's a VFib arrest, and shocked me a bunch of times. And
so when the EMTs came.
Yeah, when the EMTs came, and this was at the height of COVID, so that's why, you know, it took 10 minutes, because they had to protect themselves. We didn't have vaccines. We didn't have anything, really, barely had PPE, and that's what took so long. And then my back door was locked, so they busted open, knocked it down, and then shocked me, I think, 5 times. And
And I mean, any of us know who've had to do CPR just how hard it is to do. Like, after a minute.
She was a bit sore after the next day. Absolutely. It's amazing, you know. Yeah, even 2 minutes, right? You're supposed to.
We swap the residents out because they're tired after 2 minutes, and you know, it's really hard work. And to do good CPR is
when
hard.
it's a loved one, it's different.
You
know.
Just a remarkable story. And what you emphasize so well in your when you tell these stories is what it is as a family to go through a cardiac arrest.
Yeah, everybody thinks about the patient, right? And of course, like it happened to the patient, but my cardiac arrest, it was in my body. My cancer was in my body, but it happened to her. It happened to my wife. It happened to Kristin. And a lot of times, these types of things are just as, if not more, traumatic for the family. And usually, for an out-of-hospital cardiac arrest, as you know, it's usually the family members who respond. It's trauma, is what it is. We're telling people all the time, learn CPR, learn how to do chest compressions. But that's not a trivial thing to do. We take it for granted in medicine. We do, right? And then the after effects of that are something that we just don't recognize. And so Kristin uses this term co-survivorship, which is a fantastic term to really describe, what it is that she's experienced, because there's PTSD, there's trauma associated with doing what she did. We've been talking a lot about co-survivorship. She does amazing advocacy work. She's creating a guide to help other people, other co-survivors, to navigate that trauma.
And there's another way that I think we often talk about in our clinic, that these kinds of conditions are often genetic. And so there's also an implication even beyond the immediate family, who are obviously have witnessed a given event. But then there's the question of, well, could this affect family members?
Well, and the after effects, we call them aftershocks of this event. One of them is just fear. Like, I was afraid of being alone for a long time. Like, I would never have come here because I had to be in a hotel room by myself. There's no way. I would, for weeks, I would wake up to find my wife checking to make sure I was breathing in the middle of the night. Checking to make sure the kids were still breathing.
This is exactly what I'm saying.
And they had echoes. They're evaluated totally fine. But it's just that uncertainty of it. So.
And I think, like an aftershock, I think it's a great metaphor. You mean it's most at the beginning, but then there's little ripples that happen, and eventually they get smaller. They never really go away.
They don't.
They get smaller.
Still haven't gone away
over time.
It's a continuous process of putting your life back together after something like this.
Amazing. Through your comedy, you've also, we touched on it just a little bit earlier about the moral center of this and a little bit about the publishers, but I think partly because of those experiences, you've sort of understood, not just from a doctor's perspective, but from a patient's perspective, how absurd our healthcare system is.
This event really kicked off all my content that I make about the healthcare system, because I learned so much experiencing it from the patient side of things. I had a huge fight with my insurance company to cover all the bills. I had surprise bills that
they told you were supposed to determine while you were unconscious.
So the ambulance took me to an in-network hospital, but the doctors in the hospital were out of network.
And you should have known.
I should have known. I didn't call first before to check. So it's and the thing is, when we talk about advocacy, this whole thing kicked off a bunch of advocacy that I do about the healthcare system. Advocacy works, and now we have the No Surprises Act, which what happened to me wouldn't have happened. If that was in place, and so it works. It works. Sometimes we get into this feeling like our healthcare system is so dysfunctional that there's nothing we can do to make it better. But I always push back on that, because we can. And we've seen wins.
We see that, I think, and that message came through today from you, one of hope, right? We can make things better. Of course, we're used as doctors to looking at the patient in front of us and trying to make their lives better, and we've always felt agency over that, sometimes less and sometimes more, but that feels like something we can control. But what we often feel we can't control and causes stress within doctors is, of course, the system. It's very hard to control. But I think you've also shown us that through the power of comedy, through the power of your following and your network, these advocacy elements can move the needle. And one step at a time can move us towards a better system.
That's the way I think to approach it. And everybody can do it. Either in person or social media. Like, just educating people about the healthcare system is advocacy, right?
And we had Mark Cuban come to Grand Rounds recently and talk also about how he's thinking about disrupting the healthcare system from the outside. He's obviously not a physician, but someone who's been involved in the healthcare system and realized how absurd it is, and thinking of ways of
that's great. I love what he's doing, with cost plus drugs. And, that's an area that as physicians we don't really know a lot about coming out of our training.
No,
the
nothing.
pharmacy side of things.
Yeah,
right?
when he was here, I did show of hands to say who's heard of a pharmacy benefit manager. Thankfully, in a way, nobody really did.
Right,
yeah.
and I didn't.
Yeah.
And it took me, I actually went in, because I've made a couple of videos about PBMs, because once I started hearing about them, I was like, I cannot believe this is what pharmacists are dealing with.
Yes.
This is what our patients are dealing with. I was a practicing physician at this point. I went to a community pharmacist near where I work. I was like, can you explain this to me? I can't even wrap my head around what exactly they do.
Yeah.
And it's just eye-opening. And that's an area that we all need to be more informed about, because you know, the insurance companies, they have their hands in so many different places, pharmacy being one of them.
Yeah.
But now United Healthcare is the largest employer of physicians in this country.
Yeah.
So it's this vertical integration that their tendrils kind of infect everything that we do in healthcare, and so it's not something we can ignore.
Yeah, that education through entertainment, is that something you actively think about, or it just sort of comes about?
I can't be add about anything.
Yeah,
no, it's you know, I'm always looking for some kind of angle or some way to add some humor to it. Part of that's just my nature.
Yeah.
But also, that's just how you reach people now.
Yeah.
You know, it's people respond to humor and comedy. And so you're going to get more people looking at your stuff, and you're going to spread your message a little farther.
Yeah. Well, we had absolutely standing room only today.
That was a great
It
crowd.
would appear you are at the peak of your powers, but where do you go?
Where do I go?
Where does Dr. Glaucomflecken go from here?
Good question. I've never been a major future thinking person. You got to get my wife here. She runs the business.
She does. Yeah. I've heard her.
She is the CEO, strategy forward.
Okay.
I just make my silly videos. But we have projects that we've been wanting to do. Obviously, we have our podcast, which has been a lot of fun. Doing more deep dives into topics, having guests on. I talk a lot about ophthalmology. For people who want to
Somebody's
learn.
got to.
Somebody's got to, exactly. And that's knock high with the Glaucomflecken, so that's fun. We have a newsletter. We have different ways we're trying to reach people, and every now and then we put a live show out there.
Yeah,
so.
the live shows. I'd love to catch one of those. Your animated series
is
a new thing. That looked perfect.
That's fun.
Fit for your
comedy. We self-financed it ourselves. I realized how expensive animation is. So we did a few episodes that's based on our characters.
Yeah.
Because I've always thought these characters they're cartoonish in a way.
Yeah, no,
right?
Perfect.
So it lends itself, and so we want to do this, and what we're going to do is we're going to try to see if we can find some external funding or maybe pitch it to different streamers, see if anybody wants to pick it up.
Yeah, we'd love to see you on mainstream TV.
And
Comedy Network.
At the very least, it was just a fun project, fun to see.
Yeah. Well, you've made so many people's lives brighter, Will, and obviously your own patients, but by reaching this really huge audience. You've been such an inspiration, and we can't thank you enough for being here.
I appreciate it.
Yeah, thanks so much.
The preceding program is copyrighted by the Board of Trustees of the Leland Stanford Junior University. Please visit us at med.stanford.edu.